This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center in Alexandria, Virginia. And I'm going to discuss the question of whether I'm a candidate for ketamine therapy. It's a question that many people have asked. So, do you first have a condition that is treated by ketamine therapy? We're referring to ketamine infusions. And things that we know that work well with ketamine include treatment-resistant depression. But just regular depression and early depression and new onset depression are effectively treated by ketamine infusions and ketamine therapy. So is post-traumatic stress disorder, anxiety disorders, obsessive compulsive disorder, bipolar depression, postpartum depression, and then certain pain situations such as headache disorders, migraines, cluster headaches, trigeminal neuralgias are examples of headache disorders that are treated with ketamine therapies. Then there's CRPS, which is chronic regional pain syndrome, and phantom limb syndrome, in which people feel pain in limbs that have been amputated, and neuropathies of various types, as well as addiction disorders. So the other question is, do you have a condition not treated by ketamine? Things like personality disorders. So ketamine doesn't change your personality. It can't make you like something you don't like. If you don't like the color red, I can't make you like it. If you don't like your boss, I'm not going to make you like it with ketamine therapies. And if you have a toxic environment, so when you go home after your ketamine infusion and you're fighting with your significant other, or you don't like your job or your car or your position in life, ketamine won't change that. It may give you more resilience and more flexibility and adaptability to deal with the day-to-day dings that you get. But again, it won't change your environment. That is dependent on you. Ketamine is not a treatment for schizophrenia. And people with multiple medical conditions, heart and lung issues, on oxygen, or have had a recent heart attack or stroke, would require some prior medical authorization and clearance to get ketamine infusions. And then there's nociceptive pain, which means things like arthritis in the knee or the back, things that are directly affected with pain, not due to just small nerve fiber neuropathies. And then negative attitudes, fixed beliefs. We can't change a person's beliefs either. So a person has to really be positive in their frame of mind if they want to get better with ketamine therapies. So again, referring back to active medical conditions, if you've had a heart attack, especially in the past year, a stroke, uncontrolled diabetes, uncontrolled hypertension, pregnancy, uncontrolled sleep apnea, COPD on oxygen, for example, asthma that's very severe, or emphysema, or active addiction problems. All of those would require some sort of medical clearance. And you also have to recognize the limitations of ketamine therapy. It is effective for treatment-resistant depression, with 70% of patients having response or remission. It is a treatment, not a cure. And ketamine therapy requires follow-up treatments and booster infusions, so you need to recognize that this isn't just a one-time situation, but it can make your underlying medications work better. It can put you into remission. It can make you more effective and feel more hope and more positivity with better decision making. And you do need to continue your regular antidepressants or have them adjusted in such a way that they work. Certainly, ketamine can allow you to maybe alter your underlying medications, but they do serve a purpose in terms of treatment of your depression or mood disorder. And it's going to be important for you to incorporate lifestyle changes such as diet, exercise, sleep regulation, and stress reduction. And of course, addiction treatment as needed is important. If you're having active alcohol use or active cocaine use or opiate use, ketamine is only effective once the person is in a detox state with underlying treatment for the addiction disorder, and ketamine is added on top of that type of treatment to basically help out with the underlying mood disorder. And of course, you want to continue your regular psychotherapy. It's important to continue to develop the toolbox to deal with the day-to-day problems. Remember, ketamine key points include ketamine therapy does not change your personality. It requires inner healing and active participation of the patient. And it requires a positive attitude. And that this is a treatment that will require ongoing or intermittent follow-up. And we do provide periodic infusions, usually monthly. People can come in as often as they want for infusions. And we frequently use home-based ketamine nasal spray, racemic ketamine, not Spravato, and also oral RDTs and tablets of ketamine to help out with the effectiveness of ketamine infusions and maintain that neuroplasticity. And it's important you'll need to still work closely with your therapist and psychiatrist. And recognize that everybody has a different response to this treatment. And there's no way to know exactly who's going to get great results and who does not. But the important thing is that you maintain that positive frame of mind and that you're an active participant in your own healing process. What are the risks of ketamine therapy? There is a low abuse potential as it's given in a prescriptive manner. In the infusion sense, if we give an IV infusion, it's basically controlled completely by us. But if we give prescriptions for home use, for oral and intranasal spray, then it's basically given in a certain amount and supposed to be used in a certain way. Obviously, there's always the chance of use and misuse and abuse of ketamine, but there is no true withdrawal component to ketamine itself. The ketamine does work to improve mood in the sense that it creates neuroplasticity. And it's important to recognize that basically this is an ongoing treatment. There is not typically cravings for ketamine. Individuals generally don't even really care to use the ketamine itself per se in the home front. It does not change your behaviors or your personality. And the risks of side effects are particularly during the infusion, which include nausea, vomiting, dizziness, and maybe some brief blood pressure and heart rate changes that clear up quickly after a short period when the infusion stops. The final risk you have is your time and your money spent if there's no improvement after the infusions. And again, maybe about 30% of the people don't have any change or don't recognize change, even if there is change in terms of different mood states. What are the benefits of ketamine therapy? It is rapid acting within hours to days. Generally speaking, 70% of patients improve or remit, having failed many other treatments prior to this. And ketamine can make your other treatments, including psychotherapy, work better. It can make your underlying antidepressants work better. And there are studies showing that ketamine mixed with escitalopram or Lexapro at initial depression treatment actually makes the Lexapro work faster and better. And also ketamine can be microdosed in between infusions as a home treatment, as a maintenance tool. And it can be stopped at any time, and there won't be any withdrawal and there won't be any sense of craving. Now, if the person has underlying depression that's still getting worse, then that certainly can return. Now, we also do use ketamine to treat certain addictions, cocaine use and alcohol use disorder, as well as opiate use disorder, especially when people have pause or post-acute withdrawal syndrome, in which they feel that emptiness and those cravings and basically have low mood or no mood or to feel depressed. Ketamine can be very effective when there's underlying treatments for basically prevention of relapse.